We have some friends who are joining on Zoom also. Debanjan, Nilesh, Vikas, thank you so much for joining in. It's 6 p.m. and one of the things we really want to get right is to start meetups on time and finish on time. So one more meetup getting started on time. So I'm really happy about starting on time, and we will finish on time at 7.
Hey,
So
Jatin.
I'm Jatin. I'm one of the co-founder of eChai.Network. We host engaging startup mentoring meetups in 25 global cities in 15 countries. Now everything has moved online, but hopefully by the end of this year, we'll be able to start our in-person meetups everywhere again. Every week we do host these amazing startup growth panels where we take up a very specific sector and invite awesome people. So thank you so much, Ashutosh, Romita, Manish, and Abhinav for accepting the invite and being part of this HealthTech panel. So a couple of housekeeping announcement. We will have some friends who will be live with us on Zoom, and it is also getting live stream on eChai's social media channels. So we'll take some questions. So friends who are right now live with us on Zoom, in case if you have any questions, you can ask in the chat. So basically at 6:30, I'll enable you to speak up. So not just read out your question, but basically you can also speak up. But if you ask us a very specific question, that will help me to enable you to do it. And those of you who are watching on social media, you can ask in the comments. I'll take up some of those questions. The format will be like all our other panels. We'll have each of the speaker will speak for 2-3 minutes about their work, about their firm, and then we'll get to the discussion. So thank you so much, everyone. Again, if this was a physical meetup, typically I would have asked everybody to clap louder. Then, but we'll just make do with what we could do on Zoom. So thank you so much, everyone. Again, we'll just get started with our session. Those of you who are on Zoom, you can use some emojis to tell us that you're watching it, so that we feel also excited. So thank you so much again. Romita, if you can tell us a little more about your background and about MedSamaan.
Absolutely. So, the reason why I was very fascinated with healthcare is because I became a patient when I was 13, 14-year old, and I was detected with blood cancer. So, at a very early stage, I became a stakeholder of this healthcare ecosystem in a negative way. So, I saw all the gaps myself. I mean, being a patient at the same time, getting exposed to how difficult it is for the nurses, for the doctors, for the patients who cannot afford treatment. So that was extremely inspiring for me. And then I charted very focused path, which was cancer research, studies around cancer biology. I took up biotechnology and botany and biochemistry, and I did my MBA in biotechnology management. Then I joined Biocon in the nephrology department. So I've had exposure to various super specialty, oncology, nephrology, ENT, so on and so forth. And because pharma was very difficult to foray into, and medical devices and diagnostics was seeing light. This was in 2009, 2010. So I just jumped into. I was also heading up Indo-Dutch company's healthcare department, where I learned how to launch medical devices in India. So that's how my third company was born. So before that, I did start up a few other companies, which was into LED and solar and big data analytics for pharmaceutical companies. So I'm still running my third and fourth company. MedSamaan is my fourth company, wherein we started distributing a lot of medical devices from all over the globe and making it affordable in tier 2 and 3 areas of India. So we operate from Mumbai, Delhi, currently Hyderabad as well, and we are taking affordable solutions. So we are the launching and commercialization partner for a lot of startups across the globe, and that is the whole idea of MedSamaan. Post COVID, we are focusing right now on online channels, but mostly it has been offline because it's about relationship. It's about filling the gaps of the stakeholders through offline interventions.
And as a matter of fact, you are right now live from hospital.
Yeah.
Awesome. Uh, Ashutosh, if you can tell us a little more about you and mfine.
Sure. So I come from internet technology background, and I think this is again mfine is third venture that I have started. Before that, I co-founded Mintra, so that was a superb journey, creating something from scratch to that kind of scale, which took it to almost $1 billion scale. And before that, I was running a software product development and services company. So that's about myself. I passed out earlier from IIT Kanpur. So out and out lover of technology and how technology can influence people's life, especially internet and mobile technologies. mfine is a sort of a virtual hospital. We are trying to solve problem of access to quality healthcare and how people can manage their health better through mfine digital health platform. So we are pretty much creating a sort of a cloud hospital where we are aggregating top hospitals and various other institutions to provide health as a internet service. That kind of concept. So basically, you come and you avail various services on mfine platform, be it consultation or prescription delivery to home, diagnosis test, long-term care program. So all such product and those are fulfilled by our partner across India. So we have got 600 hospitals on our platform, where almost 3,000 to 4,000 doctors who have been there on the platform across 32 specialties, who have been fulfilling these various services. We have partnered with all the top diagnostic players from Lal, Metropolis, or Thyrocare, Newberg, such kind of players. We have got 400 basically radiology centers across India. So we have been delivering service across urgent care, specialty care, and chronic care. And yeah, so that's the platform. Apart from that, we have been building various health management tool where consumers can come and they can manage their health better. These would be sort of an assessment or where you can come to know condition of your various diseases. Then there would be suggestions to manage those conditions, and then there could be various tools which helps you to pretty much make your day-to-day routine much more healthier. So that's what we have been doing at mfine. That's about myself.
Brilliant. Thank you so much, Ashutosh. Manish, after seeing you, I'm feeling little cold.
Yeah,
But
well, not that's how cold North India is. So
if you can tell us a little more about you, about NanoHealth.
right, yeah. So I did my undergrad from IIT Bombay, and after that, I was solving the operational problems of large organizations like Tata Steel, Sony, Lenovo, and so on. My dad is a doctor, and I saw his hospitals, and I mean, like, and basically, like, hey, I'm solving it for such a large organization. So, I think there's a lot of improvement that can be done for your own patients as well. But soon we realized that it's not the problem with only one hospital, but it's pretty much everywhere. There are a lot of operational issues that can be improved once someone reaches in a hospital. Most of the time the best care is provided, but most of the time the challenge is when to reach, how to reach, and so on. So our journey started, when I was studying at healthcare management at ISB, and after that, we won something called HealthTech Prize, which is like the largest student competition worldwide. And with the problem, that we wanted to solve was, how do you solve the problem of non-communicable chronic diseases like diabetes, hypertension, etc. And that's when we started. But one of the catch there was it has to be solved for the very poor people. And so we did we did do that, but we soon realized that preventive health and, I would say, so-called poor, does not go hand in hand. I would say, just from the perspective of payability, but then we soon realized that it's not only about poor. Even with rich people, they don't care about their preventive health, so-called their health, until something really goes wrong. So our goal primarily has been that everything to do everything possible to ensure that someone does not have to go to the hospital. And so basically, it's not only about the other way to put it is like, healthcare is very transactional. We do diagnostics, we do consultations, but what happens after that, basically neither the patient or nor the doctor. So we are kind of trying to link that gap. In other words, we say that today's healthcare is reactive and fragmented, and we are trying to make it proactive, coordinated, and continuous. A lot of tech play into it. My first venture, but it has been a while, so it looks like there has been many ventures within it. So yeah. Yeah.
Awesome. Thank you so much, Manish. Abhinav, if you can tell us a little more about your background and about Tricog Health.
Sure, sure. Hey, Jatin. Really nice to hear from everyone else. I think, unlike many other people, I come from a pure. Actually, my background is more as a techie. I'm a computer science graduate, 2002, and worked with a large variety of people, including Microsoft and Thomson Reuters is where I did a large stint. And what I was doing over there was building architecting systems for wealth management, so to help rich people get richer, right? So after a little bit of time, that takes its toll. And I was kind of wandering about in around the 2013 2014 time frame, where I met Dr. Charit Bhograj, who is the CEO of Tricog Health. And he came to us with a very simple problem, right? So he's a cardiologist, interventional cardiologist. He came to three other techies with a simple problem, saying that, look, I've got patients who come too late to me. These are guys having heart attacks that, if detected within the first hour, I could operate upon them and just they'd be fine, right? But people show up one day late, 2 day late, and really it's a very simple test. It's an EKG or an ECG that you can do, and if you diagnose the heart attack in time and get it to a cardiologist in a tertiary care center, we can probably manage it. The resources are there. And I was in that state where I was like, disillusioned. What am I doing? How can I contribute? And I felt like, okay, this is a good problem. It's a significant problem. It's an important problem. And I think all of us would have heard about this scenario that, oh, this cousin's father or some uncle somewhere, they thought it was gas, or they thought something heartburn, and they waited, and no one took them to a hospital, realized that they were actually having a heart attack. Men usually are more susceptible to ke kuch nahi hua hai, no problem, I'm fine, my left arm is hurting, must be some muscle pain. So too many, I think we all have heard incidents like this, and this is completely preventable. So Tricog was founded with that particular vision, right? That we can use data, we can use analytics, we can build algorithms to solve some very meaningful and pressing problems. So Tricog Health is a cardiology-focused diagnostic company. We started in 2015 with this. We have a big vision, but we started with this specific thing that let's prevent these preventable heart attacks, right? And what we did was we built a small communicator that connects into ECG machines, transmits the data over what then used to be 2G networks only. Doctors would turn on and off internet to look at their messages. That was 2015. We've come a long way since then. And get the two, in fact, what we have is 24/7 team of cardiologists and doctors who look at this ECG and provide a diagnosis in 5 minutes. And as we started scaling, we've got data scientists. So here our algorithm started scaling, and we are dealing with a capacity of about 200,000 ECGs right now, all from about 12 countries that are coming in. Together, we've diagnosed over nearly 5 million ECGs so far. And that's thousands of heart attacks that we detected. That's something that we feel very proud about, that was the mission. We're on that path. Since then, we've also added other modalities like echocardiography, TMT, and really our vision is to build out the systems, the tools, the algorithms, and the services to solve the entire problem, right? So that people get access to high quality diagnostics in time, when and where they need it. So that's been our journey so far. We're very deep into cardiology.
Brilliant. Thank you so much, everyone. Friends, those of you who are live with us on Zoom, in case if you have any questions, you can ask in the chat. We'll take up some at 6:30. We'll take up those audience questions. Ashutosh, you mentioned about Mindra, huge success story. And so what was that key thesis for you to get into health? And what were those early days for you in the first 6 months of mfine? How did you go about it? What did you do? Ashutosh.
Yeah, I think at the time when I was planning to come out of Myntra Flipkart ecosystem, again wanted to go back to something which I used to love, that building again from small and making it big. So we started along with Prasad, who's other co-founder with me. So both of us were at Mintra. So we started thinking what could be the next thing that we can look at, and it has to be meaningful also. And at that time, again. Around 2017 18, I was not that young also, and now having kids and getting a lot of like, okay, such kind of issue where we had to go to doctors. So started facing the challenges. How do we access healthcare in India? So health education, I think these were the couple of sectors we started looking systematically, and then gradually getting gravitated towards health because there were concrete problems, and then traveled across China, US, and Europe to understand healthcare systems over there, and figured out still in India, application of technology in healthcare delivery is very nascent. And the concrete problem statement that number of doctors in India are pretty less, and they are distributed in a very skewed manner. So access to quality healthcare was a challenge that we took up. We thought how we could leverage mobile internet, which was getting penetrated pretty fast at that time, and it is still, and half of the India is already on mobile internet. And the other thought was, how can we expand the overall capacity of the healthcare system? So how we could leverage AI to build efficiency at the time when healthcare is getting delivered. So with these two thoughts, we jumped into this, and yeah, we actually were fortunate since we had friends at Mintra who also got excited. So we got a couple of folks. So you can say we borrowed team pretty much from there, and yeah. So initial days, so big focus was for 6 months understanding the healthcare, because we came from fashion background. And it was a very different vertical altogether. So if I look at my like, okay, the kind of subjects I was dealing with earlier, like what kind of inventory I'm getting, what kind of fashion products were I'm getting, it was very different versus now doctors, hospitals, and personally I was not um, uh, that much aware about medicinal terms. So had to go through, started building a lot of connections with doctors, started understanding consumer behavior, started understanding the kind of products those were there in the market, and then the focus was how to build the right product and right solution for the consumers, and where it is differentiating in terms of experience, and actually solving the problem what we were set out to solve.
Yep.
So those were the initial 6 months for us. Before.
Awesome. Romita, you have a considerable health experience when you started your own business. So, same question: the early days of your venture and how your experience from a health background helped you in your startup initially. You'll have to unmute and speak up, Romita.
Yeah. So yeah, initially I was a patient. From there, I was a researcher. I had a very different experience there. A lot of drugs are already there on paper. However, the academia is waiting for the pharma companies to buy them. So I moved to industry. Well, industry works in a very different manner. Again, we have public sector as well as private working very differently. In private, we see a lot of incentivization. So because I learned as I was working, it was easier for me. So what we did right was doing pilot of whatever we were doing in a very small scale. So we encouraged a lot of failures at co-founder levels, at founder levels, and a lot of my team and co-founders weren't from healthcare background, and they brought very new perspectives. So a lot of times I was biased. I felt like I shouldn't allow, for example, a particular operations could have been done the other way, or that is how we do it. We have different cuts for the whole supply chain. So they tried to disrupt it. So I wasn't really okay with that. But I'm happy that I allowed that. And that kind of, we have seen a huge disruption and huge success stories of things that couldn't have been possible. So, for example, the earlier days where we were hitting, because of my bias and background, the hospitals were the only go to places, as well as the important doctors, we call them KOLs. However, the payment cycle wasn't really helping us. We needed a good cash flow. But because of the experimentations and the pilot, we saw that retail as well as pharmacies are giving us good return. They are giving us volume. So we shifted the model. So these were the initial days. Lots of experiments, lots of failures and successes. Of course, that we simulate.
Awesome. Thank you so much. Manish, you won Health Prize. So a lot of innovative health tech startups, they'll end up winning a lot of prizes, but very few end up building it as a venture. So in your case, what did you do it right so that after 6 months also you're building the same venture?
Yeah, I mean, well, I think the mission, or I would say the problem is so big, and basically someone has to stick it out to, I mean, the problem, I mean, if I were to just look out in last 6 years, I mean, what actually have changed with how much of the perspective of people outside when it comes to health or preventive health has changed? Actually, not much. I mean, still when I go to, I mean, yeah, so like when I'll go and pitch to the corporates that, hey, your employees deserve better. Well, and so many diabetic people, so many hypertensive, and even when I throw numbers to them that, only 89% of all identified people will even go to a doctor. Do you want to do something about that? And, basically the response would could not exactly in so many words, but hey, how do I care? So but if I, but still a long way to go. I think we have to basically, yeah, I mean, a lot of words has been thrown. So from sick care we need to move to truly healthcare. I mean, preventive. I mean, one thing we are realizing in access to healthcare is just not enough. While there are, of course, enough number of people who do not have access to good, I would say, doctors, or not enough doctors, but I mean, like, we need to ensure that long-term, this broken, fragmented healthcare system can be connected in the right way. And of course, technology is the only way to do it. I think, I mean, this problem is so big, and it's not only in India; it's pretty much around the world. I mean, things are happening in spurts here and there, but the problem remains the same. So yeah, I think maybe one lifetime is not enough.
Okay, awesome. Friends, in case if you have any question, ask in the chat. I'll enable some of you to speak up. Abhinav, you mentioned about a domain expert came to you with a very specific problem, and now you are able to successfully build it. So what was that? Like, a lot of people have this thing. Lot of techies being approached by domain experts, that, and this is a problem, but they are not able to build the solution. So what really worked for Tricog Health in your early days?
I think I would not, we would not have, at least I would not have come together with this team if we didn't have a domain expert. I had seen the pitfalls in a previous attempt at a startup of not being a domain expert and not having, and this, especially in medical, it's too scary. It's too scary because there are subtle differences. I come as an engineer, chalo, let's try this and we'll compile again. You can't do that with healthcare, right? You can't compile again and try again with healthcare. So there's a different perspective that needs to be built in. I think what worked for us is that previously, and I'll just take the example of what we do is ECG diagnosis. ECG diagnosis has to be done within about 10 minutes. That's when it's effective. You have to do it immediately. And previously people had tried solving bits and parts of the problem, right? So give a platform where you can put your images and then someone would do this, or form a group of doctors and a WhatsApp group, things like that. I think what worked for us is that in healthcare especially, people cannot put things together themselves. You have to solve the entire problem. You cannot go to them with a tool. Now log in over here and pick up this tool and build your own solution. They're just not like that. They don't have IT staff. It just doesn't work that way. So you have to solve the entire problem. And what we did was we went to our customers with an ECG machine that was connected, plonked it in there, you turn it on, you take an ECG, you don't do any other steps. It automatically transmits it. We give them the SIM card as well into it, comes to our medical team, and they get back the report via an SMS. You solve the entire problem. That worked for us. I think anything short of this, doctors would not have adopted because they just don't have the infrastructure. They just cannot be bothered. They cannot solve anything on their own. Right? So I think the entire thing, solving the entire problem for us, was a big deal initially. No one had done that earlier. So,
awesome. With a lot of early stage startup founders or those who are already just started it, and we want to talk about growth. So in your journey, Ashutosh, which was those critical milestone and why that happened that really helped you scale up mfine really really well, Ashutosh?
Yeah. So I think the way we were building our business, it was city by city. So first we had to get supply network where we could get the hospitals and doctors to partner with us. So that was the way we started, and we picked obviously Bangalore because all of us are from Bangalore, and we started our business from Bangalore. So we started building the network, and then started getting the hospital, and then obviously started some bit of marketing to generate the consumer demand. And we realized that more and more doctors we are adding, we are getting better conversion, and more and more specialities we are adding, we are getting more and more people. So that's the way we initially bootstrapped and started building the demand and growth. Then once we had little more money, then we started expanding ourselves into other geographies, and then we picked up Hyderabad, then Delhi NCR. So that's the growth journey, and it is driven by product, more and more product, and denser and bigger supply network. That has been the driving force for the growth.
Awesome. Romita, what was that game changing milestone for your company, and what do you think why that happened?
Sure. I think working with the government. So we had an idea that it was. However, when we started working with the government, we started getting orders and a lot of leads. And the best part is every order becomes your referral point for the next order. So that was one of the game changer. The second is again working with institutions and corporates, which referred us to the chains, the whole chain system. So we did the right thing by choosing chain of institutions or chain of hospitals, chain of pharmacies to work with. And the other thing was foraying into retail. So home healthcare is coming really is the new preventive self monitoring wearables is the next big thing. So foraying into that, foreseeing that 2 years back was a game changer for us.
Awesome. Manish, in your case?
So, well, I think we just got started, I mean, like we do.
Same begins for
So,
you.
yeah. So, I mean, the way I said, if, the A to Z is a journey, we are still at a small A. That's how I put it. No, I think we are to identify which model, which is the right business model to go in while we continue to solve, I would say, the tech problem, which is like fragmented and, reactive so-called healthcare, the right business model to go in. I think the right way to pitch, I think that was a big, I would say, game changer for us. I mean, saying that, oh, just for example, our focus has been, working with the corporates. I mean, we kept showing, the dashboards and all. Well, this is great, but this is awesome, but the moment when I would say the users started loving it, and I think the big thing has been the convenience. Just the convenience, it just adds to the. I think that has been one biggest, I would say, addition which we didn't realize in the beginning, but we are seeing that when people are becoming more and more, I mean, addicted to it, and that's kind of bringing them back to basically everything that we are doing. So yeah.
Awesome. Arijit has asked this question. Arijit, open your mic. I'll just allow you to speak up. Avinav, what was that critical moment for you that really changed the game for Tricog Health?
There has been no game changer. It's a slog all the way through. It's like 20 overs to 30 overs of a match, but extended over like 5 years. No, we've started working with governments. I think working with large diagnostic chains has been good because they really need the efficiencies. So that helps. But I can't think of a single one. It's just, you grind through it. I think it's healthcare, right? Healthcare is like that. I find it's incremental. I tell people who I recruit over here, product managers over here, come in here if you're willing to work for a decade. You're not going to make a difference in 6 months or a year or 2 years also.
Yep.
It's
No,
a
this
decade-long play.
getting the million users in one day, that won't
That's
happen.
not going to happen. Right? You can't
Arijit,
move fast and break things.
yes. Arijit, I have enabled you to speak up. Can you ask a
Yeah,
specific
yeah.
question?
Thanks.
Yes, Arijit.
Yeah, thanks, Jatin, and thank you all for this insightful session. So, as Ramita mentioned that they have been working with some of the government projects. So, I'd like to understand, like, whenever you approach for a government project in the field of healthcare, like, how do we, a startup or a company, stand out from others, and how do we actually approach to such projects, and what makes us, back such projects in that field, be it a software healthcare or be it a hardware healthcare?
Okay. Arijit, your voice was very low, but Ramita, were you able to understand his question? So can
Yeah,
you please repeat that question so that those who are listening get an idea, and then you answer that? Yes, Romita.
yeah. So Arijit, as I understand your question, so if your product is outstanding, you would stand out. And then your next step should be to articulate the solution to the government. So in that case, whether it would be local purchase, government has the power not to release a tender and buy it from you. And in case they would be, they have to bid, then you have to bid ensuring that the technical specifications match the product. The second option is if you don't have a product that is outstanding, it's okay. You don't have to stand out in terms of product, but most importantly, your service has to stand out. So if you have great service, the government looks for, it doesn't look for one time buy. There is AMC. There are various ways you could service. It could be servicing of consumables, future buy, so on and so forth. If you can convince that you are there for long haul and you would be ready to service their need, your reps would be there when they need it. You could train better. You would be there, say a phone, you would stay a phone call away. I think the deal would be yours.
Awesome. Arijit has one more question, which I'll read it out. Kushagra, I have enabled you to speak up. Can you ask?
Yes, hi everyone. So I hear from all the panelists about the silent diseases which are quite prevalent in our society. I just wanted to understand what are the challenges in making a consumer feel worried or do something about a future disorder where in India most of the people are very problem solution oriented and don't pay too much attention about what could happen in future. So just wanted to understand what are the challenges we all face.
Okay. Very good question. Who would want to take this up? Ashutosh?
So I don't know whether we should create a worry or try to convince consumer that something wrong can happen with him. If he because that's not the right way to tackle consumer mindset. If I go in front of a consumer and he is pretty much healthy, but there could be probably some problem appearing in next 6 months. I can't say him that you might get something in 6 months and start your treatment. He would not reciprocate well, in my opinion. I think what we need to do, I think first we need to start building those habits among consumers. I think that's the challenge we need to solve. That there should be it's your body, it's pretty much machine. How do you check it frequently so that you know more about your health or body? I think that's the important step. And that's the behavior change we need to drive among consumers, and tell them that yes, build a habit of doing regular checkups of your body, and then look at your parameter, and based on that you bring changes in your lifestyle. So I would probably go in that direction and create a solution which actually changes consumer behavior to pretty much do their own assessment. It could be deeper assessment based on various samples. it could be tools to collect data. I think that's the way we could go about and probably prevent diseases, what could happen in future.
Awesome. In case if you want to ask more question, you can ask. So typically when we do these panels, we have this particular part where we open up for panelists to ask questions to each other in case if they want to ask. So Romita, if you were to ask a question to any one of the panelists or all of them, what would be your question? Yes, Romita. This helps me increase my question bank. So next time I ask good questions.
I think before that, I wanted to just add something to the last question. Yeah, I think no, I mean I'll completely agree with what Ashutosh is saying, and of course, fear plays a very important role in all of this. But one of the very important thing is convenience. I mean, the best example I give is if I am having a high blood pressure, right? If I'm hypertensive and I don't feel a single thing, there is no reason for me to take a step right or left to do something about it. And especially if you're talking about to lose half a day to go to a doctor and taking tests and so on and so on, just forget about it. So I think what may be the best way to make it so convenient for him that he can go ahead and take that maybe one step right or left. I think that plays a very, very important role across all of this.
Awesome. Romita, if you were to ask a question, what would be your question?
Yeah, my question would be to Abhinav as well as Ashutosh, whether to go deeper in a market or go wider. As in, deeper would be selling different products to the same customers, and wider would be to expanding to different geography. So, if we had to choose between one, what should that be, and why?
Yes, Abhinav.
Sure, I can go first. We face the same challenge, right, Romita? And I think if you're going wider, pick your geographies very carefully. You'll start seeing that entire countries are very small bucket items, and because of regulations, it's not like you can just enter a country. It's not SaaS, right? So there's lots of regulation, especially if you're going hardware related things. It's actually, even if you have a CE certified product, you have to get it registered in that country, etc. Right? So if you're going wide, you have to pick like a high value country. It's too expensive otherwise, right? In the same geography, definitely go deeper, because distribution costs are gonna be better in that way, right? Because if you can sell the same product, that's something that we face, right? It's just distribution is so hard and so expensive, because I cannot do anything digitally with doctors. You have to go and meet them and give them 3 hours of your life. Until then, they're not even gonna speak to you, right? It's like you sacrifice 3 hours of a sales guy's time, and that's the first time they'll say hi to you. Yeah, that's about it. I think, yeah, definitely we can sell more products, better geographies, pick the right geographies. It's one thing that we found, and since we're on that topic, is that they're very different. So in India, we do have this concept of a diagnostic center now that exists in Philippines. That simply just does not exist in Vietnam and few other countries, right? So for us, Philippines worked well, but the mechanics of all healthcare systems are so varied. Some places you just cannot go and walk in and get a test. You have to go through some referral, or you have to go through a doctor who will send you to a tier 3 system. Some places are completely government based and insurance based. So it's extremely complex. I think going wide, be very, very careful. Just go to US, right? Make your money if you can. Yeah.
Ashutosh, you briefly mentioned earlier.
This question, the answer to the question lies in what you want to do. There's nothing right or wrong answer. If you are solving a problem which requires you to go very deep, and as an entrepreneur, you believe there is a big enough market, if you solve that problem, then you go after that. See, when do you want to go wider? Okay, so you have created a product which cuts across various people, and then you have an opportunity to go wider, where you can create a larger business. Yeah, the solution to that would be probably you could find the product easily, which is not easily, like, okay, it would be, obviously everything is tough, but end of the day, the problem statement would be such that the whatever solution you are arriving at, it would be attracting a lot of people, but whether that would make that kind of impact, I don't know. When you are going deeper, suppose you have to do a research around a like cancer. I don't understand much, but I will take that example. And that solution lies probably 5 years of research. Then you have to go deeper. But after that, the market is big enough to probably fulfill the financial returns that any entrepreneur or any investor would be seeking out of that problem. So I think there's nothing wrong and right. What you like, what you feel like, okay, this is the problem I would like to solve, then go for it. Yeah. So it is that way, I believe.
Manish, what would be your question to any one of them? We'll do this circle. Yes, Manish.
Yeah. So, yeah, I was trying to answer. So I think one of the question is like, what has been like the biggest, learning, which we thought that, or say shock about healthcare as the industry, because most of the people over here did not have healthcare background. So, what was like a big thing about healthcare? One big insight which thought is, oh, healthcare is so different from others.
Okay, good question. So all of will give a shot to the answer. Abhinav?
Um, See, for me, it was very different because, where I came from a financial background, right? So, I mean, financial world where you build products, and if you could make some margins on something, you can make something 10% better, there's money to be made. So it's all about the margins kind of a business. And it is you perform something, you decrease some time limit or something, and you just make, you get paid for that. Medicine is fundamentally a fees based thing. It is opinions. So if you see, a doctor only offers you an opinion, he's not giving you a solution. So healthcare is not a market that I will cure diabetes to you. I will manage it for you. I will give you opinions on this. So it's a fee based. It's more like lawyers and doctors, they charge fees, and that's opinions. So I come from a mindset of, so everything is solvable. You take inputs and here comes an output. And that was a big learning that medicine simply isn't like that. There's an art to it. There's diagnostics, and you take that into consideration, and you cannot program it away. So how do doctors fit into this? How do you fit technology into this? It's far more complex than what you think. That, or doctor is looking at this guy, age 42, this is blood sugar count, blah blah blah, here's the output, here's the decision. It just isn't that way. uh, you cannot program a way out of this one. That was my biggest learning.
Yeah. Ashutosh?
I think the biggest insight that we are having with in healthcare, I think it is hard to build trust with consumer in healthcare category. So unlike other category, um, where people are whatever consumer product they are using, probably whatever goes wrong doesn't impact consumer directly. But here, if something goes wrong, I think trust is completely broken. And other thing is that every consumer is having his own way of thinking. So hard to define the standards. That how do you build that trust? We grapple with this situation. Sometimes doctor has written more medicine. Patient says, "Oh, this doctor is not good because he has given so many medicine." Sometimes the patient would give feedback that doctor talked to me for whatever time, but he only has given just one medicine. So very difficult how to build trust, and trust is very very important. So I think that's biggest learning as compared to previous venture. Um, and it is really hard. And as Abhinav said, it's incremental, it's grind. You keep on doing, building this trust with consumers. So I think that's the learning and insight that at least I'm having.
Yeah. And Romita, what has been your big learning after building multiple health tech ventures?
Sure. So one of the weird thing about healthcare was at times good quality is not good enough, right? So people don't want good quality, and there would always be different kind of people. So one size fits all model just doesn't work, and because it won't work, you just cannot make standardized models. And because you can't make standardized model, there are infinite possibilities. So as a company, it gets so difficult to scale, because you thought, okay, you cracked it, and then there was another variable that just pops in right there. So that's a learning, and I'm sure it would be a learning for everybody, and it's not going to stop.
Abhinav, if you were to ask a question, what would be your question?
So I'm going to ask, I think, see, if you look at in US and if you look at in Western markets, the reason why there is so much value for innovation and small gains also is because healthcare is very expensive. It is very expensive. It is very valuable. Medical equipment costs a lot. There is a lot of regulation. Insurance costs a lot, right? So there is value to be captured, right? I just wanted to check with the guys around here their broader takes on the economics of healthcare. How do you see it going? Is it going to become expensive, insurance led, more government? I don't know. Where do you think the value gets generated in healthcare in the coming years?
Yep.
In India. We've seen how Western markets perform. So, yeah.
And you must have included it in your business plan also. Well, Ashutosh, what would be your take?
If I understand question correctly, Abhinav, your question is where exactly value gets generated in healthcare?
You want to serve everyone, right? You want to serve the billions of people in India, but who pays for it? How do you make that happen? Where things are still very. Cheap is what sells right now in India. So, how do these economics change? How do you see that changing in the future?
So I think yes, that definitely that's a challenge in healthcare sector because it's a sector where probably it's not as like people don't celebrate like okay, something gets sick and it's a burden, correct? And when there's a burden, people try to spend less until unless they are in that situation where they had to really spend and upfront spending definitely not many people at this point of time probably invest that much on health apart from few people or you can say top 100 million people. So I think that's the challenge, but the belief is more and more digital we go in health, more and more data we capture, because end of the day, data will tell you the facts. And when people start looking at the data, then they realize, and then the behavior would start changing, and then consumers would start spending on health. So if you look at the the behavior change that we have already been seeing because of COVID. Now consumers are a lot more focused towards health and more worried about the outcome. And there have been different psychology, at least on our platform, we have been noticing those kind of consumer behavior changes. So that's one. I think with data, today, a lot of payers, especially insurers, with lack of data, I think they are limited in terms of providing various products or solution to consumer, where they could take a role for various you can say various kind of care where they can come and be the payer and because today lack of data doesn't help them to create right business model. So I think going forward, a few things would that's what I believe. Like, okay, what would happen? One is consumer behavior getting changed, especially because of COVID, and then data coming and making more and more awareness among consumers towards better health, and thirdly, overall ecosystem with more data. Working towards making people healthier, and those business models are coming up. I think that's where value can be created, which would be probably which could be distributed among all stakeholders, and probably profitable business models can come.
Okay. Ashutosh, your questions will complete this cycle of panelists asking questions to everyone. What would be your question? And then we'll
I
get.
just wanted to understand from Manish. See, I think um, managing chronic conditions and building that engagement with the consumer. It's definitely a difficult problem. We have been seeing these models successfully getting implemented, at least in US market, where companies have generated some scale. I think some successful mergers and acquisitions have also happened. So, where are we in India at this point of time? And Manish, have you seen the algorithms and the programs those US companies have created? Have they delivered the right outcome to the consumers? So, what is your thoughts and views on that? Just wanted to get some knowledge download from you.
Right. So I think, there is a very, very strong need. I mean, like we all keep hearing that India is a diabetic capital. I mean, more than diabetes, now that we have enough data, we said that actually hypertension is a lot bigger problem than even diabetes, which no one talks about. And I think to some extent, Tricog is helping that, so address that. But that also the only extreme, level, I would say. So I think your demand is definitely a huge problem. I think when it comes to US model, so we are at first, like in India, we are just starting. I mean, the whole approach towards health is just starting to change, and we're definitely COVID has made a huge difference. As 73% of all the people who had died had actually some level of comorbidity. So I think that's just beginning to change. We in our data also we have started seeing that change. People are coming forward. Even though everyone knows that what's the problem with a bad high cholesterol, but still what to do about it, they don't know, they don't do. But now that's where they need two things. One is the nudges at the right time, and of course convenience, because I mean, like they're not ready to go to a hospital for cholesterol. I mean, if they can have a video consultation, have a doctor, I mean, like that's okay, but there's still one medication. 1 month they'll take the medicine, but what happens after that? I mean, still I would say a long way to go. I would say that in US, what the likes of, let's say, Livongos and others have been able to do is definitely, I mean, impact-wise, wellness has not worked. So all these, I mean, like yogas and all has, I mean, there is a very, limited ROI, at least from the organization's perspective. And it has been found that the people who are very proactive by themselves, they are the ones who are utilizing it more. So even if so I think, but apart from that, I would say once you have, let's say, a captive population and you are able to create that timely nudges, it is impactful. Okay, so we have been able to see, from a health checkup to a follow-up consultation. For example, if you just leave everything by itself, only 10% of the people even bother to go for a follow-up consultation. But if once you start creating those nudges, I mean, that basically number, pushes down to at least, let's say 60 to 70%. So timely nudges, convenience, easy. I think these are some of the key things which we have learned over a period of time, which can actually make an impact on the ground. Yeah.
Awesome. So we 6:54. We'll finish at 7. So we want to do a rapid fire. So you can give a quick and brief answer. So we can do 3-4 circles. Romita, which is your favorite book or a podcast that you liked and you would want to recommend other founders? Favorite book or a podcast?
Favorite book, Dying. There's a book, Die Empty.
Okay.
So that is something I would recommend. It talks about how to see death and how we can learn from it and change our perspective every moment, seeing it with a different, angle, and especially being in healthcare, it makes a lot of sense.
Brilliant. Ashutosh, favorite book or a podcast?
I think there's no favorite book as such. Mostly my time goes on TechCrunch and Tech in Asia. That's what I read. So if you have to ask me which book, I think I think Google story was pretty inspiring. So Google Plex was pretty good.
Okay, brilliant. Manish?
I like the book Nudge. I mean, it talks about how you can start changing behavior. So yeah.
Okay. Abhinav?
So books, I really like all the stuff by Atul Gawande. So Checklist Manifesto was very interesting. It got me a little bit more interested in medicine and how doctors look at it. Podcast Acquired is one I listen to pretty regularly. They do pretty in-depth breakdowns of mergers and acquisitions, and they spend a good amount of time. So it's very research-led. It's not just two guys chatting with opinions. So they go deep into it. So typically 1.5 hour episodes.
Yes, brilliant. The latest one is around Bitcoin.
You follow it.
Yes. So we talk a lot about learnings from failures, learning from mistakes. So if you were to do one thing, what do you feel that, and what is that one thing you could have done little differently in your journey? Romita?
Yeah, I started this LED business way before time. So I should have waited.
Okay. Ashutosh?
It would have been a success.
Yeah. So we want to Nilesh also asked a question. So Ashutosh, is that one thing you feel that you could have done little differently?
I think initially when we went into healthcare, probably we could have equipped ourselves with more health or medicine knowledge, how the sector works, and we went probably too much focused towards building the product, where monetization for some time it was on back burner in our.
Okay. Manish?
Well, yeah, we only learn. So I very proudly say that, I mean, this is the fifth version of our own product and solution. So 4 times we failed, and but every time we have learned, and the fifth version, I mean, like where we are, and we continue to evolve ourselves. So yeah.
Any particular thing that you feel that you could have done little differently?
I think vision wise, the scope of things that we wanted to do. I mean, in healthcare, going deep, I mean, one of the things that we have realized, I mean, geography wise, you should go deep. But when you're talking about solving the problem, I mean, I think you do need to have a wider perspective.
Okay.
Yeah. So
it's 6:57 and I want to do 3 more rounds. Avinav, what is one thing you feel you could have done little differently?
I think, we tried to innovate too much on operations and sales, which was completely unnecessary. That's where I feel like we should have just hired someone from the industry who knew how to run people and forget about it and focused our innovation and tech into the product side of things. That's big learning.
Yep. So the question now is, if everything happens the way you imagine it would be, in that case, what would your company be? So what would Tricog be?
What Tricog would be a platform where you would get accurate cardiac diagnosis using algorithms 24/7 in 10 minutes.
Okay. Romita, what would MedSamaan be?
100 million people getting access to healthcare on time.
Wow. Ashutosh?
I think the vision that we set out for ourselves, I think we are pretty much on track. So
So everything is happening anyways on time.
there are challenges we are trying to solve, but I didn't have such a milestone per se. But yes, I think there are challenges we are solving. But what we wanted to solve, what we started with, I think pretty much we are on the same path.
Okay. After such answer, it is difficult for other person to answer their milestone. But what would NanoHealth be?
yeah, we want to be a digital infrastructure for tomorrow's health.
Okay. The next answer you give in just
like
one word.
yeah.
Which particular activity you enjoy doing the most in your entrepreneurial life? Romita?
People management and negotiation.
Okay.
This is beyond work or within the work?
Within the work, or you can say beyond work one also. You both the answers.
Okay. No, I like tracking startup. That's it.
Okay. Manish?
Yeah, I think selling to doctors.
Oh, wow. Selling to doctors and negotiation. I thought this was a difficult one and you enjoy, so that is good.
I missed the question, Jatin.
You don't have a choice.
Which particular activity you enjoy doing the most in your business life?
I think designing interfaces for doctors, because the innovation is so far behind over there. It's really good low hanging fruit.
Okay, awesome. Neeraj, at 7, so we want to finish it on time. But we have tagged all our speakers. It is live on Twitter also. So in case if you have more questions, you can ask over there. Last piece. So typically ending Zoom call is tricky. So what we do, the moment last person answers the question, I immediately close the call. So Romita will be the last. The moment you say your word, I'll just close the call. The question is, if you were to describe your entrepreneurial journey in one word, what would that word be? Abhinav.
Slogging.
Manish.
Amazing.
Ashutosh.
Hustling.
Awesome. We are finishing on time. So thank you so much, everyone. See you on social media and hopefully in person someday. Romita, what is that one word that describes our entrepreneurial journey?
Roller coaster ride.
Awesome. We have a series called that where we